Hello, everyone. My name is Nika Darvish, and on behalf of our entire research team at the University of California, Berkeley, I'm proud to be presenting our work on doula perspectives on maternal health futures. The Doula Futures Project blends futures thinking, racial equity, and human-centered design to imagine alternate futures for maternal health and the role of technology through direct engagement with doulas from different parts of the United States. Our project team consists of our core team, led by our principal investigator, Professor Jaspal Sandhu, and our advisory committee. Doulas are trained professionals who provide educational, physical, and spiritual support before, during, and after childbirth. Unlike clinical roles, doulas engage in the birth journeys of birthing people holistically. Doulas can also support pregnant people of color who experience the impacts of racism by providing individually tailored, culturally appropriate care. Doula care is among the most promising approaches to combating disparities in maternal health. This project explores potential innovations that may improve the future reach and impact of doulas, including emergent technologies. The project takes place at UC Berkeley's Wallace Center for Maternal, Child, and Adolescent Health. It engages doulas from across the United States, including community doulas, which provide services at low or no cost to underserved communities and are often members of the communities that they serve. With racial equity being a main focus of the work, we ensured that at least 50% of the participating doulas identified as community doulas and 50% identified as doulas of color. Community doula recruitment has been our biggest challenge, and we have leveraged social media platforms, notably Facebook groups, and email to reach community doulas. Phase 1 of the project included informative research, which consisted of a literature review and coordinated informational interviews with doulas to grasp a deeper understanding of doula work from the doulas themselves in order to frame the project and interview guide appropriately. Phase 2 involved semi-constructed one-on-one interviews and futures workshops, all of which were conducted virtually. We received a total of 62 doulas interested in being interviewed and ended up formally interviewing a total of 26 doulas. A subset of doulas from one-on-one interviews were then invited back to participate in futures workshops, of which 3 were conducted. As this project is a work in progress, we are currently transitioning from phase 3 of the project to phase 4, which includes qualitative data analysis of interviews and workshops for emergent themes until thematic saturation is achieved, as well as project socialization. Semi-structured one-on-one interviews have explored doulas' experiences working with expectant mothers, specific services that doulas provide, their training and certification process, emergent technologies, and the future of doula care. We spoke to doulas about what their journeys with clients look like from the start to finish, what challenges that they may face working alongside medical teams, the role of technology in their work, and questions regarding the future of doula work. A subset of doulas were invited to participate in workshops to imagine alternate futures for doula care and childbirth in the year 2040, using techniques and approaches from the fields of futures thinking and human-centered design. Workshops included 2 to 3 doulas and 1 facilitator. Futures thinking exercises such as visioning and backcasting were used. For example, during the visioning exercise, we asked doulas to imagine what would the ideal birthing experience look like for birthing persons by the year 2040. Doulas were able to post virtual sticky notes with their answers and engage in discussion on a virtual platform called Jamboard. Backcasting, another technique from the field of futures thinking, involved creating a roadmap of tangible steps that could be taken in order to reach the vision that participants created for the future of doula work and childbirth. Figure 1 shows which states doulas who have engaged with the Doula Futures Project represent. In total, the Doula Futures Project has reached a total of 26 states across the U.S. Whether a doula has applied to be on the project advisory committee, expressed interest in being formally interviewed, if they were formally interviewed, and which states our doula advisors represent, or a combination of the list just described. Now, out of the 26 doulas that were formally interviewed, 50% identified as Black or African American, 27% identified as white, non-Hispanic, 11% identified as Hispanic, 8% identified as Asian, and 4% identified as non-specific. Almost 90% of doulas that we spoke with identified as a community doula. Doula's years of experience was almost evenly split between having less than 5 years or more than 5 years of experience. and the top two most common types of doulas we spoke with identified as either a birth doula or a birth and postpartum doula. Now, figure 2 shows a map of which of the U.S. states the 26 doulas interviewed represent. One-on-one interviews explore doulas' experiences working with expectant mothers, specific services, their training, emergent technologies, and the future of doula care. Figure 3 is a word cloud of the most frequently used codes from a subset of 10 of the 26 interviews, which are coded to date. We are currently in the qualitative data analysis phase of the project, as this work is a work in progress. Codes such as technology, doula training, doula roles, and services are the most frequently used codes from the 10 interviews coded thus far. Doulas are primarily talking about how technology is impacting their work, how they identify their role as a doula, characterizing their doula training experiences, and describing their client relationships and doula services through storytelling. Figure 4 depicts some of the most common themes that have emerged from the 3 Futures workshops that have been conducted to date, which encompass the broader topics of doula's experience, birthing person's experience, and the role of technology. With regards to the ideal future for the doula's experience, doulas emphasized how doula burnout could be minimized if doulas were provided more emotional and financial support in order to make the doula profession sustainable. Doulas also highlighted how doula care should be made accessible to everyone and the need to have more in-home births rather than in hospital settings. Conversations around the birthing person's experience included demedicalizing the birthing process, ensuring patient-centered care rather than provider-centered care, and focusing efforts to increase birth workers of color through trainings led by BIPOC. Doulas across all workshops also emphasized how they see an advent in technology use for non-hospital-centered doula work. They hope that doulas are provided access to medical health records and also shed light on the limitations of technology when it comes to the quality of care doulas feel that they can provide to their clients. This quote highlights the unmet need of doula support and peer review groups that may assist doulas in feeling more emotionally supported and may combat feelings of loneliness, which may decrease doula burnout rates. This is especially important since we know doula-assisted mothers are 4 times less likely to have a low birth weight baby, and among Medicaid beneficiaries, 41% less likely to have a C-section, and that doulas can also support pregnant people of color who experience the impacts of racism by providing individually tailored, culturally appropriate care. This quote highlights the deficits in the current system, which fails to provide individuals who have just given birth the sufficient postpartum support needed. Doulas have emphasized the postpartum period as extremely important in setting up a healthy future for both the birthing person and the baby. Now on to lessons learned and next steps for Doula Virtues Project. Unlike those in clinical roles, doulas engage in a pregnant person's journey holistically, providing them with a unique and valuable perspective for future innovation. There is a need to further elevate the voices of BIPOC doulas to support equity in birth outcomes. Postpartum doulas are a key strategy to keep Black, Indigenous, and other women of color connected with primary and specialty care. Conversations that doulas are having highlight the mental health challenges that doulas experience through vicarious trauma or loneliness. Technologies such as apps, social media platforms, and virtual support groups may be one strategy to provide emotional support for doulas and decrease doula burnout rates. Finally, doulas believe the birthing process can and should be less medicalized, including less unnecessary C-sections, more community prenatal visits, and the use of birthing centers instead of hospitals. Doula Futures will be continuing until May of 2022. We plan to engage additional doulas through interviews and Futures workshops. Next steps include continued analysis, writing, and socialization of the results to broad audiences, including doulas. We would like to thank all of the doulas who have participated in the Doula Futures project and have shared their stories with us. And if you have any future questions regarding the project, feel free to contact Nika Darvish at this email. Thank you so much for listening.